Hi, this is Ryan Belter with CHI Performance Excellence, and you're listening to Operations Advisor Productivity Training. This is a recorded session for those of you who were not able to attend one of the live webinar sessions the week of April or March 12th. So this is to cover the Premier Operations Advisor tool, which is going to replace Visionware for productivity. It's also replaced ActionY for benchmarking, so it is an integrated product. Today's session is really around the productivity component of that. So we're going to get right into things. Here's the agenda we're going to cover today. Really going to give you just a little bit of a conceptual background on the project and talking about where data comes from, showing you the reports that will be available to you. We'll get into action planning as well, which will be basically the equivalent of the VIP tool from Visionware. And then we'll move into how do you log into the system and navigate and do a live demo. So if you are listening for a second time, you may be able to advance to some of the latter stages of this agenda. Also, just kind of as a precursor, what you're looking at here in terms of a presentation will be available to you. It's available for those of you from the FHS Tacoma side of things on your Finance SharePoint site, same place where you'd find your 110 reports. For Roseburg folks, you're going to find these materials on the share drive under the Productivity Tools Premier OA folder. If you have any questions, you're going to be able to reach out to your local resource. But again, this presentation is available. There's an extensive user guide that's available. There's also a cheat sheet, which I have open here. So this will be a one-page document that you'll be able to refer to, just a quick reference guide. How do you log in? Who do you reach out to for help? And here's an email address that I'm going to mention a couple times in the presentation where you can reach people from Performance Excellence. What are the action plan criteria? This will be important. So there's a lot of information on this one-page document that you'll be able to refer to, as well as the extensive user guide. And we'll be posting some other materials out to these locations as well. So please keep that in mind. So some of the resources available to you, again, my name is Ryan Belter. I'm with the Performance Excellence team. Leah Jacobs is also on my team. She's for the FHS folks. She's going to be your main point of contact as you leave this session today. Kathy Roberts in Roseburg will be the main point of contact there. Bonnie Scarlett's been very involved in this process as well. So those of you on the Tacoma side, she may be someone you want to reach out to as well. The executive teams from both markets have been educated on this product and this whole project. They're engaged. They've provided input into how we're going to use this tool. So they've been an integral part of getting to this point of rolling it out to you today. This project overall began several years ago as part of the CHI financial turnaround. We've always had a labor management program in place, but it was a time for us to kind of reevaluate how we were doing things. So at that point, with the burden on CHI and meeting margins and trying to stay financially sound so we can reinvest those resources into our organization, we had to look at things all across the organization, how we could do things differently. And so from a labor management perspective, it was an opportunity for us to replace an aging and outdated Visionware product and also replace our benchmarking product, which these were two disparate products. We were able to get one integrated product through the Premier Operations Advisor tool. So this has been rolled out throughout CHI. We actually started using the benchmarking data for the FY18 budgeting process, so that was used across the organization, and now we're rolling out the productivity component. And for FHS and Roseburg, really this is the second to last market to receive this rollout. So we've already implemented in Nebraska, Kentucky, Texas, North Dakota, Iowa, Arkansas, Tennessee, and it's really the Pacific Northwest now, and then Fargo will be the final division to receive it. So the good news is we've gone through a big learning curve and gone through a lot of the early challenges of implementation. We've already kind of gone through a lot of that. So we're bringing this product to you, and we know there's still work to be done, but we're excited about this new tool. So anxious to get it to you today. So what we're going to talk about today mostly is biweekly productivity. There's also daily productivity, which is available, so we'll talk about that too. Again, keep in mind that we're replacing Visionware. Visionware will still be accessible to you for another pay period or two, so you can do parallel comparisons to Visionware versus OA. But we do need to turn that off at some point. We don't want to run dual systems. So we want you to, as soon as you leave here today, start actively looking at your reports side by side. So if you do have any questions, we can get those things addressed right away. Daily reporting has started in Operations Advisor. So kind of similarly, we will turn off the Visionware daily reports very soon. So again, look at those reports and do your comparisons and reach out to us. As far as the VIP or the action planning tool in Visionware versus OA, we want you to still use the VIP tool in Visionware if you've been doing that up to this point. Do it one more time for pay periods, the most recent pay period, and then the next pay period we will be moving into just using Operations Advisor. I've also stated that we've already used Operations Advisor for benchmarking for FY18, and we're actively, each of your facilities are actively involved in the FY19 budget process. So the benchmarking data is available for that right now, and as you're having those budget meetings with your finance and decision support teams, this benchmarking data will be one of those pieces of information available in that process. We won't talk much about benchmarking today. In fact, I'm going to jump ahead here. Just overall, I want to save some time for this call, but overall, just keep in mind the difference between benchmarking and productivity. So they are two different concepts, but they do share and have an interrelated relationship. Benchmarking is really more of an annual or quarterly. It's some sort of time period look back, and typically at CHI we do it on an annual basis, although in Premier you do have the ability to look at things on a quarterly basis. But it's that opportunity to kind of self-assess and compare against other organizations, other similar types of departments, whether it's a department within another facility at CHI or comparing outside of CHI. Premier has anywhere from 600 to 800 other clients who subscribe to their database, and we are able to compare against those. So this is an opportunity to evaluate and compare as we strive for year-over-year opportunity and look at where there may be areas of improvement. It gives you an opportunity to reach out to those peers and make connections and start to learn about other processes, other operations that are out there. That information ultimately becomes an input to the budgeting process. And that budget, as we're working on now for FY19, once that is finalized and set, those budgeted hours and those budgeted volumes will be used to derive a productivity target, which will then be measured on a daily and biweekly basis. That will also go into your your monthly responsibility reports for budgeting and your shift management tools if you have one. So that target should be consistent throughout all of those tools. Ultimately, the productivity data then feeds the benchmarking process for the next year. So it's a cyclical routine, and there is an interrelationship, but they are two different distinct processes. So if you have any questions about the differences there, have any questions about benchmarking, because we're not really going to talk about that a lot today, please reach out to your local resource or hit us up on the psg@catholichealth.net email, and we'll get in touch with you and try to address any of your questions. With that, I'm going to move into data sources. So as we're thinking about OA versus Visionware, the data really isn't changing. The data sources themselves haven't changed. The data still comes from payroll, loss in payroll, Kronos time and attendance data for daily hours, whether it's Star or Meditech or Epic for your volumes, Lawson for the general ledger. All of the data still comes from those sources. However, we are now leveraging the data through the CHI Business Intelligence Data Warehouse. They're already collecting all of this data. In Visionware, we had our own data extracts we had to manage. When we had issues with it, we had to deal with those. We had to load those files. A whole bunch of things went along with that. With using business intelligence, we no longer have to do that. The data flows automatically. They're already doing quality control on the data. They're using it for numerous dashboards. We're just letting the pieces that we need from those data sources flow into Operations Advisor. So you don't have to be too concerned with that flow chart. The one piece, though, that comes into play that may apply to some of you is the manual stats and the contract labor. So if you're one of those departments with either of those two pieces of information, you're going to continue your typical process you've always had. Submit that data to either Leah at FHS or Kathy in Roseburg. In FHS, it's noon on Tuesday of pay week. In Roseburg, it's noon on Wednesday. So we really need you to hit those timelines. Otherwise, it's going to delay our ability to process data for everybody. In the future, we may move to having you be able to load the data directly into OA, and that may streamline the process a little bit, but we'll let you know when we're ready to go down that path. So when it comes to volume, every department has one primary unit of service that we're going to measure for productivity. Just like we did in Visionware, in nursing units, it's equivalent patient days. In imaging departments, it's procedures. In the OR, it's OR case hours. In dietary, it's the patient meals, so on and so forth. There's one standard unit of service that has been identified for every department. That standard unit of service has been agreed upon by an overarching committee called the CHI Productivity Collaborative. They meet monthly. Each of your division is represented by a senior leader or two, and every market is represented by a senior leader across CHI on this committee. And they have agreed upon the standard list of units of service being measured. So whenever there's a request to change something, it has to flow through that committee, and ultimately then that would flow down to me and your local resource to be able to make those types of changes within the system. So just know it's not something where you can say, I don't like this unit of service, I want to change it. It has to go through that process. And the reason for that is we need consistency. We need standardization. We need all CHI similar types of departments to measure the same thing for comparison purposes and to allow us to be able to benchmark better and have more peers to be able to compare to. So in benchmarking, you can look at things and form compare groups based on multiple types of volume perspectives. But in productivity, we're ultimately measuring that one primary workload, the one that is the standard. So really that hasn't changed that much for most of you. In Roseburg, there were some departments that went through a change in unit of service to match that standard. If you have any questions about that, please reach out to Kathy. But volume is measured based on that, whatever that unit of service is, there's a definition that goes along with that. So we count those things, and generally for most departments, you're going to be a variable type of statistics, so something that can be based on charge data. So we do count things based on the time charges are charged, and not when they actually go out on the bill. Also, we count things based on service date, not the posting date. So that's not any different than what it was in Visionware, but as far as service dates, just keep in mind that we only count things within a 6-week window for each pay period. We're only counting charges within a 6-week period. So anything that falls outside of that 6-week window, we'll catch that up on a quarterly basis. So basically, if this pay period, let's say pay period ended March 10th, the pay period would be February 25th through March 10th. Well, any charges that were posted with a service date between January 28th and March 10th would be counted this time. If it in the next pay period a charge showed up that was for December, a December time frame, and it just now got posted with a service date sometime in December. It wouldn't get counted at that time. It wouldn't get counted until a quarterly interval. So we're always capturing all charges, but if they fall outside the 6-week window, they won't get caught up until that quarterly interval. Payroll data. So payroll hours, these are mapped consistently across CHI. The only thing to keep in mind here is education, orientation, meeting, training, those types of things are productive. Always have been, nothing's changed there, but just want to remind you of that. From a time and attendance perspective, Chronos information is used for daily reporting, whereas for a biweekly report, it's the loss in data. It's what's actually paid out to employees. From a daily perspective, it's Chronos. So we always know that data is changing. There's always edits being made. We'd like to think that managers are keeping up with their edits on a daily basis. We know that's not always the case. In an ideal world, we would move in that direction. But with that not being the case, we do go back and capture it. Every day we look at the last 14 days of data. So we're always updating based on that. So within a pay period, we've got the whole pay period covered with any changes that would have occurred over those 14 days. So that will ensure that your data does get updated at the time those edits are made. So if we generally pull that data early in the morning, so if you were to have your edits made before midnight the prior day, they would get captured in the next day's reporting. The only thing that won't get captured is your contract hours, unless your employees are clocking into Chronos, in which case those hours would automatically flow into the daily report. So just keep that in mind. If they're not clocking into Chronos, we're not doing any kind of manual load on a daily basis. We are loading that into the biweekly reports, but they would not be in the daily reports. And the last piece of data is the targets. So this is, as of right now, when you start looking at your reports today, the information is based on your FY18 budget. These are generally the same targets as you had in Visionware, so if you see a different target, just reach out to us and let us know. If you had a change in unit of service, then obviously your target would change appropriately. But other thing to point out here that's not noted on the slide is if you are a fixed department and you are being measured just based on the number of hours, you will be seeing a stat called calendar days. Premier doesn't have a way to capture fixed departments the same way we had in Visionware. So you have to be on a variable type of statistics. So the way we do that is using calendar days. So your volume would be 14 days each pay period. So ultimately we've taken your budgeted annual worked hours and divided it by the number of days in the year to get a daily target, and that gets applied to the 14 days each pay period. And so for those of you who might be in a 5-day per week type of department, you're only open 5 days, that's okay, doesn't matter, everything's averaged out. So even though you wouldn't have any worked hours on Saturday and Sunday, the target has been averaged out, so it all works out. So if you have any questions about that, please reach out to us and we'll talk you through that. Alright, from a user permission standpoint, how you're going to see data when you log into the system. So from a department level perspective, you are going to be assigned a role of either an owner of a department, an approver, or you will just have view access. So to be an owner, that means, it says here generally the director, but that could actually be the manager. In Tacoma, that's generally the case. It is generally the manager. It's really whoever we've determined to be the person with the primary responsibility for staffing. And that person will then be required to receive the department level report via email. That's what the auto distribution means here. Required to receive the report via email. They would also be the person responsible for completing an action plan if one were initiated. The approver, the owner can only be one person. Same for the approver. It can only be one person. That will be the person who's responsible for reviewing or approving and rejecting an action plan. They do not have to receive, they're not required to receive a department level report via email. They can or they cannot. It's up to them. Generally, most approvers are going to have multiple departments in their view, so they would typically receive a roll-up type of report. But if they wanted to receive a department level report, they can. If you're not an owner, you're not an approver, but you need to see information for a department, then you would be given view access. That means on your dashboard you can see the department, you can see it in reports, you can see it in action planning, but you would not be able to submit or approve an action plan. And you would be optional in terms of what you want to receive via email. If you do have more than one department, as I stated previously, you can get a roll-up report. So this would mean it's kind of a higher level report. The senior leadership team will be receiving this type of report generally for the whole division. But if you have 2, 3, 4, 5 or more departments, you can receive a roll-up report. And we generally set that up for everybody. So if you didn't receive one, it may just be an issue where we haven't set up the email function or whatnot. Just let us know and we'll make sure that you've got access to that. Reports are expected to be available every other Friday. We didn't hit this the last time around just because of all the training that was occurring, but I would expect that these reports would go out on time. Actually, in Roseburg, we did hit things on time. I would expect over the next pay period or two, you'll start getting these pretty consistently every other Friday. When those reports are available, you'll know either there's 2 ways to access reports, and you'll know if you have been set up for auto distribution, because as soon as we process those reports, the email gets sent out immediately, and that email would come from oaproductivity@premierinc.com. So if you want to set up an Outlook rule to push emails from this email address into a separate folder, you could do that. That's something that I do in my inbox. I prefer it that way. I can go to my inbox here, and I've got a Premier folder, and all the emails from there, from OA Productivity, show up in this folder. So you could do something similar, especially if you have multiple departments and you get a lot, because you will get 1 email per department that you have view access to, or you're the owner of, and that you've been set up for auto distribution for. If you don't receive reports via email and you don't want to, then the other option is through report generation. There's a menu that once you log into the system, very simple, straightforward menu. You choose the report you want to run, and within a few clicks, you've got a report visible on the screen. So it's not like Visionware where you had all these static reports that you would just go pull up and open the PDF and view it. These are more self-service type of reports where you log in and generate the report that you want. And there are different hyperlinks within different areas of the dashboard or within other reports that you can click on to quickly initiate a report to run. Another type of notification that you might be receiving is an action plan notification. So if you did have an action plan that was triggered, you would receive an email letting you know that you have an action plan due. And once you complete it, the approver would receive an email letting them know that you've completed the plan and it's time for them to review it. So I've got, this is the timeline for FHS. Roseburg would just be a different pay period cycle, but ultimately when the pay period ends here on Saturday, reports would be out the next Friday. And so action plans would be expected to be completed within 3 business days, so the following Wednesday. And the day after that, an action plan report gets sent out to the leadership team showing all the departments that had an action plan, who's completed it, who hasn't. All right, data availability. So as you're going and looking for reports, as you're logging into the system, there are times where, typically we will process data after hours. But if there happens to be a circumstance where we do process data during business hours, you may log in and see this banner, this notice saying the system is processing data. This might affect what you're able to see within the system. So this would only apply to facilities that you have access to. So if if you're at St. Francis and we're processing only St. Clair, you wouldn't see this notice. So it will only apply to you for what you have access to. But this would just alert you to then click on this publishing tab, which we'll talk about a little bit later, and it will show you what time periods for what facilities are currently in process. And that means you wouldn't have access to data for those time periods at that time. So this is just a warning. It's actually a new feature that we released with Premiere here in the past week, just to help keep you guys aware of what's going on and not to confuse you when you log in and find that information is not available. Typically you won't see this though, because we do generally process data after hours. This term reporting period, as we're looking at some of these reports, that term will mean 4 pay period average. So I know in FHS, historically things have been looked at in a 6 pay period time frame. That's been used for your FTE request. It's been used in VIP. That's going to be changing to the 4 period average. So anytime you see reporting period, which will be on pretty much all the reports, that is a 4 period average. When it comes to action planning, which we're going to get into that in more detail later, what you're going to learn is there's action plans are only eligible every 3 pay periods for a specific standard. So that's a little different from what you had in Visionware. In other words, there's certain performance standards that will be established. For example, overtime at a 2%, that's the target, to be below 2%. There will be another one for productivity. There's another one for education orientation. Each of those is a standard or a criteria set. You're only eligible to have an action plan once every 3 pay periods for each one of those. But each period, if you're not meeting those criteria, the system will designate your department as the watch list, meaning you're not meeting that standard. And if you're eligible at that specific time, then the department would go on an action plan. If you're not eligible, then it would just designate the department as on the watch list, meaning you're still not meeting the criteria, but you weren't eligible for an action plan. And we'll talk about that a little bit more, but you will see this watch list term pop up on some reports, so I wanted to point that out ahead of time. Okay, so next slide, we're going to skip the key metrics. So these are the types of reports. The first half of this slide are the reports that will be available to you as a manager or director. If you're an executive listening to this call, you'll have all these reports available to you, but the one I've listed here in red, this is actually the labor productivity dashboard, which is owned by the business intelligence team. It's a really slick tool that they've developed for us that is very much like the operational finance dashboard, if you've seen that. I did do a demo for the executive team on this, so if you didn't happen to see that, we'll be happy to show that to you. But you do have access to that now, and it lives outside of OA, and that will probably be the primary tool that most executive leaders will look at. This first report under the management section is the one that can be emailed. It is the only department level report that can be emailed. The rest of these would be able to be generated through the report menu. And I actually take that back. The daily 14-day trend can also be auto-distributed. So I'll change that here on the fly. From a roll-up perspective, the administrative performance report can be emailed. The rest of these can only be generated through the report menu. So just keep that in mind. Certain reports can be emailed. If you're the owner of the department, this one is required to be emailed to you. There's no turning it off. So you can't reach out to Lee and Kathy and say, I'm the owner of this department, but I don't want to receive these emails anymore. You actually have to. Same thing with the daily 14-day trend report. Actually, with this one, if you don't find value in the daily report, we do have a way to turn that off. If we turn that off, you wouldn't have access to run it on your own at a later time. It's basically an all or nothing thing. So just keep that in mind for now. And we're working on an enhancement to where we can do something a little bit differently there, but as of today, that's the way it works. If you have any questions at all about, I'm not seeing the right departments, or I've got the wrong department, or I need to have one added, or a question about receiving or not receiving an email, certainly just reach out to us and we can make sure you do have the right access and we can clarify whether or not you need to be receiving emails. So I'm going to talk about the department performance report. This is the one that's emailed to you if you are the owner or you're just set up for auto distribution. So I'm going to go in slideshow mode here because there are some call-outs that will pop up through the animation. And we'll move through this one. It's a 6 or 7 page report. So it is rather lengthy because there's a number of graphs in the first several pages. And then the last 2 pages of the report are really more numeric. So if you like the numbers and you just like getting to that level of data, then you'll be able to go down to the bottom of the report and look at that. That latter portion will be kind of like the 6-period trend report was in Visionware. Then there's an alternate version of a department report, which is called the department drill down report, which I'll show briefly next. And that one has no charts, and it's just more time periods, and it's just a different look and feel. So if you prefer to use that one, you certainly can, but that one wouldn't be able to be emailed to you. So here, you've got your department number and name, and then you'll have the unit of service being measured and the most recent time period that the data has been processed for, in this case through June 18th. These charts in the beginning are generally always based on reporting period and year-to-date information. Then when you get to the bottom of the report is where you see these metrics on a time period basis. So the first thing pointed out here is the watch list notification. So if your department is not meeting the standards that have been established for overtime, education orientation, agency, or productivity, it will tell you here that you're on the watch list. That means you're not meeting at least one of those. In this case, it's not meeting overtime. It's exceeded the 2% goal. If this department was eligible to be on an action plan, then it would say this department is on an action plan. In this case, this department was not, probably because they were already on an action plan in a recent period, so they weren't eligible. So this department is just on the watch list. This department was at 84% productivity for the 4-period average. So for April 24th to June 18th, those 4 pay periods, 84%. We can look down here and see the trend graph, so you'll be able to see each individual time period productivity score throughout the fiscal year, as well as the thresholds, which we'll talk about here in a minute. The productivity index for reporting period and year to date, so actual hours per unit versus target, actual hours per day versus target, and then you get into the labor expense. Now this was different than what we had in Visionware. Did not have dollars. You could look at your total labor dollars, but you couldn't see it in terms of a target. So we have loaded a dollars per unit of service target based on the FY18 budget, just like the hours per unit of service target, which is used to calculate the productivity index. So when we compare that targeted hours per unit to the actual dollars per unit, that will give us a labor expense index. So it gives you a little bit of an indication of how well you're doing financially as opposed to just on an hours basis. So none of the action plan criteria are based on labor dollars at this point, but it does just give you another perspective. So as we're looking down through these graphs and into the numeric data a little bit later, you will see some shading on the reports. And so as we're thinking about some of the performance drivers, overtime, contract labor, you'll see skill mix listed here. We've actually removed the skill mix section of this report. But if you're over the target for one of these drivers and you're within a 5% increment over the target, so for example, overtime is a 2% target. So if you're at between 2 to 7%, that 5% range, the shading will be yellow. If it's over 7%, it will be red in that case. And obviously, if it's below 2%, there'd be no shading. For education orientation, which is 5%, then in that example, between 5 and 10%, it would be yellow, and above 10% would be red. And you can refer to your cheat sheet. That one-page reference guide will tell you all of the action plan criteria and what those targets are. This graph here, I don't like it. Just being honest, and I'm working with Premiere to try and reutilize this space in some other manner. But I can't remove this from the report, so just to understand what it's telling you, it's just trying to show you how does your productivity index and labor index, expense index relate. Are they, if you're in the upper right-hand quadrant, generally that's good. Obviously, if the numbers get too high, that can be of concern for sure. But in general, in this upper right quadrant, that means your productivity index is high and your labor expense index is high. But ultimately, you're going to be able to see that through the numeric data and the graphs below, so this graph isn't really of particular value. This chart is called staffing to volume. This is a correlation graph. Well, the graph itself is going to show you two variables, your volume as bars and your worked hours as a line, the line graph. The correlation comes into play here as a score above the chart. So that value can be between a -1 and a +1. That's the range. And the closer you are to a +1, the better. So if you're at a +1, that means there's a perfect correlation. In other words, as your volume goes down, your hours are going down in a similar manner. If you're moving more towards a -1.0, that means your hours and volumes are moving in opposite directions. They have an inverse relationship. So the idea being, if you're at a 0.6 or above, that's generally what we consider a good correlation. That means you're not going to see a 1.0 every pay period, but this is over a rolling 15 pay period. So every time you look at this report, in this case as of June 18th, this was for the 15 periods leading up to and including June 18th. So this is not the same score as a productivity index. It's not the same. There are some. This is more of a diagnostic tool. So ultimately, the goal is to be meeting your productivity score, to be on track with your target. But this will help maybe diagnose why you might not be achieving that. This doesn't take into account anything relative to the target. This is simply, are your hours and volumes moving in the same pattern? So if your productivity score isn't looking good, and your volume to staffing correlation is also not looking good, then that might be reason to take a deeper dive and look into the why. What are some of the causes of that? So if you're interested in more information on this, I mentioned that we have a more extensive user guide that's posted out to your shared location that I referenced earlier. There's multiple pages within that guide that talk about staffing to volume, basic correlation studies, how you can kind of relate staffing to volume to productivity index, and some scenarios there. Feel free to look at that, and if not, if you still have questions, please reach out to us. The next page will show overtime usage, so your overtime total throughout the year, and then what's the reporting period and year-to-date average. So this is at a department total. We'll be able to see a little bit later where you can see it at a job code or a employee level. But just one thing to point out here is if keeping in mind that there's a 2% overtime goal, and that you can see here that there are some line items to show the variance. Well, if you're above the 2%, then it's going to show what your variance is to being above 2%. If you are beating the 2% target, you're below that, then you'll see a value here as well, but it will be a negative number. And this can confuse people. So when you see things that are in parentheses, and this example doesn't have it, this department was over the 2%, so they're not meeting goal. But if this department were an example below 2%, then you would see parentheses around these values, indicating that these are negative numbers. And so really, conceptually thinking, there is no opportunity, there is no variance. If you're meeting the 2%, then the variance is 0. However, the report is going to display it as a negative number, and so that throws people off sometimes. So just keep in mind that that's just saying, this is the variance between what would have been expected. What was the 2% 2% of paid hours in your department compared to what you actually had? That's the difference, and it would be represented as a negative number. Contract staffing would be here. Paid time off would be here. Paid time off doesn't affect your productivity score, but obviously you might have interest in that information, so that will be available. Then you get in the last 2 pages of the report, and this is the numeric information. Kind of like the 6-period trend report, you got a little bit more stuff here. The third part of this is the labor expense information, which is obviously different than the 6-period trend report. One other thing that's different is the reporting period. Again, keep in mind that's 4 pay periods, not 6. And then the year-to-date and reporting period, both of those are expressed as averages and not totals. In Visionware, they were totals, but this would show you an average, which will be a little bit easier to compare the trend versus the time periods on that average basis. Then you get into kind of the typical stuff you're used to: actual worked hours, target worked hours. Now this example shows actual worked FTEs. This will actually say hours on your reports. If you do like to look at things in terms of FTEs, the other pay period report, the department drill down report, will show that actual worked FTEs and target worked FTEs. This one will show hours. You get your productivity index. You can see the red shading here because this department was below the threshold. And so, by the way, this call out here says 98 to 140% is the range. That is for FHS. For Roseburg, it's 95 to 110%. That would be the range used for the shading and for the action planning. And again, those are referenced on your cheat sheet so that you can check back to those. Down into the paid hours section, and then you get into the labor expense section. So we can see the actual total payroll dollars for each pay period compared to what was targeted. So again, that would be the FY18 budgeted, total budgeted dollars divided by the units of service. That target would get applied to the actual volume to come up with the targeted labor expense. So then we get a labor expense index when we compare target to actual. We also have some budget metrics. We only actually have one. We have 4 line items, but we have only loaded one of these. So you will see the budget volume, at least in FHS. For Roseburg, we haven't loaded this yet, but we may do this for FY19. The budgeted volume is just a straight line volume. It is the volume that was used as the basis for determining the total targeted worked hours per unit. So that FY18 budgeted volume divided by 26 pay periods, that's the value you're going to see here. So it's going to be the same number each pay period. So that's not the same as what you're going to see on your responsibility reports. For one, because those are monthly and this is pay period. Also, your responsibility reports may be based on a flexible budget, so that budget might be changing, whereas on here it's a straight line method. So just keep in mind those are 2 different things, but the idea here was to give you a sense of how does the actual volume compare to the volume that was used for calculating our target. Then you get into the last page, which has overtime percentage, agency percentage. You've got these different worked hours categories and paid hours categories. So if you wanted to see education orientation time, and that's a good example to point out because in the education orientation section that we saw earlier above a couple pages, that only expresses that in terms of reporting period and year to date. Here, you don't get the percentage, but you do get the hours, so you could calculate it yourself. So that's something we do want to add here. We're going to get this added to the report where we can have education orientation percentage here so you can see it for each pay period. But right now it's not there. So if you were to take, as in this example, take the, well, let me do this one because there's hours in both. Add the 27.5 to the 48.9, so you get 76.4. Divide that by your total paid hours, and that will be your percentage for education orientation. But you will be able to see that number within, if you had a variance, you'll be able to see that in the action planning module. So we'll show that here in a little bit. Notice though, these blue font underlined items, these are hyperlinks. You'll be able to click on these to be able to auto-generate those reports. So if you want to see the hours by employee, you can click on that link. Or the overtime report, you can click on that link. No, just one word of caution, and I get a little bit ahead of myself here, but I'm going to show you later how you log in. Logging in is a single sign-on process, so you won't have a username and password. So you're going to go through Inside CHI to do that. You might receive this report via email, and you might try to use these links before you've actually logged in to OA. And so if you do that, when you click these links, it's first going to take you to Inside CHI because you'll have to log into Inside CHI first. And then the report will generate. If you happen to be logged into OA at the time you use these links, then it will automatically run. You won't have to do anything. It will just automatically generate the report. All right, the department drill down report. This is the alternate version at a department level. You can see things on an FTE basis on some of these line items, which is different. As far as differences from the other report that we just saw, you don't see the staffing to volume correlation on here. You do get more time periods though, so this might be more helpful initially as you're auditing against Visionware, because you could look at the 30-period trend report versus this one. Obviously, this isn't 30 periods, you get 13 periods, but still quite a bit of information. Volume, hours, target, overtime percentage, contract labor, okay, typical stuff that you've always seen. Here you get your worked hours categories, paid hours categories. We saw that on the last report. The unique thing though comes on the third page here where you do get your FTEs by skill mix category. So if you wanted to see nursing RNs versus LPNs versus your healthcare support, those would all be listed here. Then you get your hours and dollars per unit of service, actual versus target. So this is a 3-page report, cannot be emailed to you. You will run this by going into the report menu, and I will show you that here in a moment. There's a department overtime report that you can run through the report menu. It looks like this, and honestly, I don't see much of a need for it, but it is available to you. This will just show things at a job code level for these different time period intervals, but you'll be able to see it at a employee level on the next report. So department level overtime on the prior 2 reports, employee level on the next report. I don't know how valuable it is at a job code level, but you can certainly look at it here. If you do look at this though, one thing to keep in mind is just those negatives again. You might see a variance here. Even though this department didn't have any overtime, it looks like we had a variance. That's just because that's the threshold or the gap between what was expected at the 2% level. It's saying based on the number of paid hours in this department, we should have seen overtime. But in reality, there wasn't any. So there's a negative variance. It's not real intuitive, but that's the way it works as of today. So really, these should just be zeros because you're achieving the target, you're beating it. But just don't let these negatives kind of throw you off. The department employee level detail report, much like the Visionware employee level report, very similar. There's a couple additions though. You'll be able to see the home department here because there may be employees that float in, such as these ones, the ones that are denoted by the asterisk. You'll be able to see the employee ID. Worked hours, paid hours, nothing new there. But then you have your float out. This will show you the float out department where, this employee here was home based in this department, but they floated out to $31.99. So you'll be able to see the hours associated to that float out in the department. And then the float in employee, the asterisk is denoted. And so these are employees that would float in. You would also see agency employees on here. You wouldn't see their specific name. We are loading those kind of as a lump sum total of agency for the department, but you would see that line item so you could see the hours. At some point we could go to an employee level kind of count if we needed to. So there is no volume detail report at this time. Premier doesn't have one. I've been working on this with them for a little while, and we're really close to releasing something. We're expecting it to be next month, April. So in the absence of that right now, we've made an Excel file available to you out on the share drive where the other materials are. And it's going to look kind of like this, where you can just go out there and you'll be able to filter on your department and see all the charge code activity for this fiscal year. You'll see it by pay period. Are we counting it for productivity? If so, what's the weighting factor? What was the quantity of charges? And if we multiply those together, that gives us the weighted volume. So basically, the sum of the weighted volume is the volume that will show up on your department level report. Just keep it in mind here, whether we count it for productivity or not, that just means, is it related to the primary unit of service? So if it's something like supplies, we don't count it. If it's a nursing unit, it's some sort of injection, we don't count it. We only count the room and board charges, and we count the observation hours, and we count the extended recoveries. In imaging departments, we only count the procedures that are, able to be counted per the definition. So you'll see a yes there when they count and a no there when they do not. If you have any questions about the file, again, reach out to us and we can clarify those. The one roll-up report I'm going to show you is the administrative performance report. So it looks very similar to the department performance report that I showed you earlier. And so these values that are represented here on the numeric portion and the chart are representative of all the departments in aggregate that are a part of this roll-up group. Now this one we called Premier Acute Care Facility 1. Everybody's got a different name for their roll-up. So if you have more than one department and we associated a roll-up to you, you should receive this report automatically. If you don't, let us know. We'll create one, or we'll just assign it, one that already exists, assign it to you to be auto-distributed. But I think we've got most people covered. But this would be an aggregate of all the departments in that roll-up group. Now you say, what's included in that roll-up group? Well, as you go to the bottom of this report, then you'll be able to see the departments individually that are a part of that roll-up. So all of these departments were included in those values we saw above. Now I can see what was the productivity index and the FTE variance in the current period for med-surg and so on. Same thing for the reporting period and year-to-date. You will also see a total. It doesn't show up roll-up total here on the on this specific report, but it will show that line item. Now, if you are looking at this and you say, I see the step-down unit, they're shaded red here. They obviously haven't been hitting our lower threshold. I want to take a look at their most recent pay period results. You can click on this hyperlink to auto-generate that department performance report. So it will run the one for the most recent time period. Maybe you want to see, maybe you said, I've already talked to the manager. They tell me things are doing much better this pay period. I want to take a look at the results as of yesterday. You can click the daily link, and that will auto-generate the daily report through yesterday's business. All right. I'm going to skip ahead now to action planning. Oh no, one more thing is the daily report. So with the daily report, we've already started distributing those. If you're the department owner, you're required to receive it. If you find no value in it, then reach out to Lee or Kathy. There's a way to suppress that report, but you wouldn't have access to run it through report generation either. Keep in mind your time and attendance edits and your charge entry is really critical to this department report being valuable. Obviously, if your charges are coming in late, they'll get recorded back to the appropriate service date once those charges get posted. But if they're coming in 5 or 6 days late, then your report's always going to look off until the end of the pay period, if that's when you're finally getting caught up on charges. Same thing with the time and attendance edits. If those edits aren't being made, then the hours aren't going to be accurate on the report. So the report itself will be off. So it's really important to get those edits made. Now, the daily report doesn't tie into any action planning or anything like that. It's simply a manager's tool. It's supposed to give you some insightful information about how your department's doing for the pay period, before the pay period end. comes along, and that's when your action plan would kick in based on the pay period results. Departments that are on a manual stat, we're not going to load manual stats daily, but you would still receive a daily report. It will just represent the hours and not the volumes. So that will at least give you a sense of how many hours were in the department. You could do your own productivity calculation if you know what the stat was. Just a reminder that the contract labor, unless it's entered into Kronos, will not be included in daily reporting. If they clock in to Kronos, then it will automatically show up in daily. So the daily 14-day trend report looks a lot like the Visionware report. You get your typical things: volume, hours, target, variance, productivity score. This report will always be a rolling 14-day report. So you'll see the second to last column is the 14-day average, and the last column is the period to date. So if you look here in the upper part here where the dates are, there's going to be an asterisk by the one date within the 14-day range that was the most recent pay period end. So that will indicate your end. So this time period total to date is representative of these last 3 days because the pay period ended on July 21st. So down at the bottom of this graph or grid is the cumulative variance. So what this is doing is calculating where's your variance to date and what's the makeup to get back to target. So in this case, if we had been looking at this report on July 15th, we would have had 7 days remaining in the pay period. Our variance is 112 hours, so that number divided by the 16, divided by the 7 gives us the 16. So that's telling us we would have to average 16 hours better than our target every day for the remaining 7 days to be on track, be at 100%, zero variance. Once you hit the end of the pay period, there will be no value in that last row because there's nothing to make up at that point. But we can see this department they were not doing well overall for the 14 periods. Clearly weren't doing well last pay period, a lot of red there. But in the most recent period, they're at 108% for the 3 days. So they've been above their target. They've been beating their target each of the first 3 days this period. Okay, action planning. So action planning is a communication tool. Obviously for FHS employees, you've been using VIP. In Roseburg, haven't been using the VIP tool here recently, but you will be using the action planning in OA. So it's just a way for your leadership team to set some standards and for them to be able to hear from you when you're not achieving those standards. This is a way for them to kind of assess where the opportunities are and help them assess why the organization may not be meeting specific margins. So there are 4 criteria sets. Now what I'm displaying here is for Roseburg. Number 2, 3, and 4 are the same for FHS. The only difference for number 1 for FHS is the range would be 98 to 140 for both of these. And I have this on the next slide, so it would look like that. So what these criteria sets are, or standards are, they're independent of each other. Each one of these works independently. So you, as a department owner, could have an action plan based on any one of these 4. Now, you can only have one action plan each pay period. Maximum, you only have to fill out one form, even if you're in variance to all 4 of these things. Once you're on an action plan for a specific one of these, you cannot be on an action plan again for 2 more pay periods. You skip the next 2. So those are grace periods. So basically, if in pay period 1 you had a productivity variance, then you would not be eligible for an action plan for pay periods 2 and 3. So basically, you would be on the watch list in pay period 1. And then you would also have an action plan assigned. In pay period 2 and 3, even if you're not meeting these criteria still, the system will designate you as on the watch list, but you wouldn't have an action plan. And you wouldn't be eligible again until pay period 4. But let's say in pay period 1, you didn't have an overtime variance. You had productivity variance but didn't have overtime. So everything was cool there. Then in pay period 2, you did have an overtime variance. Well, then you could have an action plan in pay period 2 for overtime. And then there would be grace period for periods 3 and 4 as far as overtime goes. So obviously, with 4 of these things in play, there's a potential you could have an action plan every single pay period if things just fell out the right way. Haven't really seen that happen very often, but it is possible. Any questions about your action plan criteria? Remember, those are listed on your cheat sheet, and this is kind of the timeline for this. So thinking about it from Roseburg perspective, on March 3rd, if a action plan went into effect, you would know about it on March 9th when the reports go out. Action plans would be due on following Wednesday, and then between March 14th and 3/31, assuming you've submitted your plan there, it's really in the approver's hands to review it and sign off on it. So that's a 3 pay period time span. So once you're on the action plan, you're not eligible for pay period 317, not eligible for pay period 331. This department would be eligible again for the next pay period, which ends April 14th, for a specific criteria set. Once an action plan has been initiated, it goes into a status. It goes into assigned status. So that means it's been assigned to the owner, and they're responsible to complete it. And they'll receive an email letting them know. Once they do submit it, it goes to review status, and the approver receives an email. So now they know to go in and review it. Once the approver has opened the plan and looked at it for the first time, it changes to reviewed status, meaning they have opened it. And then they would either approve or reject it, and it would change to one of those respective statuses. This is an example of the form. We'll actually do one of these here in a minute. Here's the steps to complete the action plan. This is also on your cheat sheet. Approving an action plan steps, and then this is what it looks like in the system. So when you do complete your plan, you'll be able to print out a report or save a digital copy of the report that would look like that. And this is the type of report that will go up to the leadership team the day after plans are due. They'll get this report with the stoplight concept to show them, here's the ones that are approved, here's the ones still waiting to be reviewed by the approver, and then these ones in red, those are the ones no one's done anything with at this point. And for the ones, though, that have been completed, this is what they've documented as their part of their plan. All right, so we're going to log in and do a demo, so let me just go through a couple more slides about logging in. So in the upper left-hand corner of your cheat sheet is a reminder about how to log in. But first things first is the browsers. So many of you have multiple browsers with which to choose from. Firefox is really the preferred version, especially as of this moment, because we are having an issue with Internet Explorer. Even though IE 11 is generally has been compatible with OA, with a recent release of some new features, we are having some issues between CHI policy and how OA handles it. So we're having, if you try to log in using IE 11, you're probably going to get a blank screen. And that's just something we're working on with Premiere to get a patch to resolve this. But as of right now, just beware, if you get the blank screen, we want you to use Firefox or Google Chrome. Google Chrome isn't supported by IT here at CHI, but it is compatible with OA. I haven't heard of anybody having any issues with it. I personally have Internet Explorer as my own default browser that I use for most things, but Firefox is what I always use for OA. I just have a better experience with it, and definitely now, because there is an IE 11 issue, I have to use Firefox. So you're going to log in through Inside CHI. You don't have a Premiere username and password. You're going to log into Inside CHI like you normally would, whether it's for Healthy Spirit or going to Workday or whatever you need to do. You're going to log in, and as your network password and username changes, this correlates, you don't have to worry about that for OA. You log in the same way you always would to Insight CHI. What you'll do is you'll go to the home page, you'll click on the clinical link in the quick links section, and then follow this path here. So it's going to look like this. Log in with your username and password, click on this clinical link in the quick links section. In your clinical work list, you'll find Analytic Portal near the top. You'll click on that, and then you might get a warning here about welcome to the collaboration site or whatever, and you can click on continue to site when you see this pop up, and you shouldn't get that again. It should be a one-time thing. But you'll click on Premier Connect in the Analytic Portal, and then that will take you to Premier's environment. So you're in their Premier Connect world, and that's where you'll click on Operations Advisor and Supply Focus. Now before that, you might get a pop-up like this that says accept the terms and conditions, and that's fine. That's a one-time thing. Just to use their website, you'll just need to accept that. But otherwise, you'll click this button and it will take you to the home page. Now once you get to this point, you can save this as a favorite, and then whenever you want to log into OA, you can just click on that favorite, and if you're not logged into Insight CHI, it's going to have you log in first, but then it will take you here. If you're already logged in, then it should take you right in. So that will save you a few clicks of the button. All right, so I'm going to exit, and I'm going to log in. Now, if I were logging in, I would log in through Insight CHI. I'm actually not going to do that just because I am using an administrator account, so my screen will look in some instances slightly different than what you'll see when you log in, but that's why I'm using a username and password here. So once you log in, you will come to this home page. So you've got a series of tabs across the top with which you can click on. But really you're only going to use these first two. Over time you may use some of these other ones, but initially it will be the home page or the reports menu. When you're on the home page, you've got a few options. There's the performance summary, which is the default view. Then you've got action plans, and you have publishing. So let's start by looking at the performance summary. Well, first, there's this graph above the performance summary to show you the view that has been assigned to you, whether it's one department or a roll-up of departments. This chart itself isn't that fantastic. The main takeaway from here would be, what is the most recent time period that data has been published for? And I may say the term published, meaning the most recent data that we've made available to you. So this is telling me March 10th is the most recent pay period. So that's what is represented here in the performance summary. The data is as of March 10th. So that's the main takeaway from the graph. So in the performance summary, you will see the departments that you've been given access to. Whether you're owner, approver, or view access. Doesn't matter which one of those. As long as you have the view access, you're going to see it here. So if you see departments you shouldn't see, let us know. If you're missing departments, let us know. We'll make sure we get them added for you. If you want to, generally many of you will have the department level report already in your hands via the email. But if you wanted to run a report, you'll just click on, and I'm just scrolling around, but I can click on any one of these. I was just looking for one that had a different result here. I'll click on this one, Imaging Services. And this will run the most recent department performance report. So there it is. So now I can review it, print it off, save it. Okay. Now you notice there that it opened up for me as an Adobe document as opposed to opening in a separate window here. That's all based on your preferences on how Firefox or Internet Explorer, whatever your browser is, those are your options. I have mine so that it opens in a separate PDF. So the hyperlink will automatically run that DPR for the most recent time period. Then you can see your reporting period, current period, and year-to-date productivity scores as of March 10th. You can sort these column headers, any of them, and you can filter. So if you wanted to filter on a department, you just start typing in keystrokes and it will start filtering it down to whatever you've entered. So then I remove that. The last thing is the action plan status. And there's a filter for the action plan status. It's above the grid. So it doesn't look like the same filters over here. But you can filter if we want to see anything that's in assigned status there. If I want to see what's in review status. And now, you may come back to this later after you've done any action planning, but this is a hyperlink to be able to run that action plan report. So again, this would be for only the most recent period. There's the report. But if you needed to run a prior period for some reason, and maybe you didn't save a copy previously, but you wanted to look at an older pay period where you had to write an action plan, you'll just go into the report menu and run that. But that's basically everything here in the performance summary. I'm going to show you here the publishing tab. If there's that banner, which it's not here now, generally it's not going to be here for you because we do things a lot of times overnight. But if you see the banner that says notice, hey, we're publishing data, then you would click on the publishing tab and you would be able to see which facilities for which time periods are processing. That means you don't have access to the data for those time periods for that at that time. I'm going to come back to the action plans. So we've looked at our performance summary, and now let's say maybe we want to run some other reports. Now we could have gone to our DPR and we could have used the hyperlinks here to run the employee level report or the overtime report. But we can also use the report menu. So if you want to run any reports, you're going to go to the report menu. And again, this isn't like Visionware where you just had reports sitting out there. This is where you actually have to generate the reports yourself. So it's very simple, and you won't see an extensive list like this. You'll just have daily, department, multi-department, and benchmarking, basically. So if you want to run an individual department report, it's this. If you want to run a roll-up report, if you've had a roll-up assigned to you, it would be multi-department. Daily report would be here. If you want to run any benchmarking reports, here. So let's say we want to run the employee level report. I click on department, and then it gives me the list of reports available. We didn't cover this one in the presentation because you won't use that one. But we want to run the employee level detail. I'll choose that report. I'll choose my facility. Notice I have a long list here. I have all of CHI. You'll only see the facilities in your division. I clicked Harrison. Now I'm going to choose my department. I'll choose 4 West. Choose your time period. It will default to the most recent. You can choose older time periods if you want. And then this one's saying which skill mixes do you want to include. Really, I want to just show everything. So I highlight all of them. And then you click OK. This one can be run as a PDF. Some other reports can be run in Excel, but this one's only PDF. So now you run it, and that will open up either in the window or as a separate file. Now you've got your employee level report. I can go back to the department list and run any one of these reports. If I wanted to run an action plan report for a prior period, I could certainly do that here and select that time period and run it. So all of these prompts basically are pretty straightforward. Now if we were to run a roll-up report, let's do the multi-department option. Maybe I want to run that. Maybe I want to run the administrative summary report. I like that report actually. And what you'll see in this list are only the roll-ups that are assigned to you. And generally, for the most part, you will only have one. If you're a senior leader, sometimes we've given you 2 or 3. But they should be fairly self-explanatory as to what they are. This one's pharmacy, this one's mission, this one's materials, so on and so forth. And you basically follow the prompts just like we did in the other screens at that point. But let me go ahead and finish that out. We can choose between current period and year-to-date or reporting period and year-to-date, and we can choose our time periods. Choose OK. This one could be run in Excel if we wanted, and then we run that report. Now that one may take a few more seconds because there's a lot of departments in that roll-up, but it should run momentarily. So that's the Home tab and the Reports menu. The Productivity tab, you won't have anything there. If you click on it, it might show you that there's an error, but that just means you don't have access. Benchmarking, If you have to update your profile at some point along the way, you would go there. OA Community allows you to see, help topics and what other clients are doing and things like that. Analytics is something you might use later on down the road when we have the new volume report. It might live out here as opposed to the report menu, but we'll show you that. But this analytics tool it's there. It's a way to drill down into data. If you wanted to play with it, you can't hurt anything, but it's really designed more for people like Bonnie and Leah and Kathy and myself. If you are a finance or decision support person and this would be the type of tool you need to get some more information, we'll certainly be glad to show you how to use that. You won't see this orange thing, but one of the things we're working with Premiere to release here soon is a better dashboard. And you could obviously saw our dashboard wasn't that slick, but this is kind of the concept that we're working on for what we'll replace that dashboard with. And so it's much cooler, allows you to get to more information without actually having to run reports, and you can drill down from there. So that's more to come on that in the coming months. But basically, back to the home page, I'm going to go to the action plans at this point. So action plans are right here in the middle. And if you had an action plan due, you would know because you received an email alerting you. Your report would say it, your DPR report would say it in the top left corner, this department is on an action plan. Or you can just log in here, and if you see your department in this list, then there's an active action plan, meaning it hasn't expired and it's not fully approved. So departments will continue to show up in this list as long as they are not fully approved or have not expired. Now the expiration date is that 3 pay period time frame. So once the department is on an action plan for a pay period, the next 2 pay periods are grace periods. So that's where the expiration date comes in. The due date is really, the 3 business days after the reports come out. The day after the due date, nothing formally happens on the due date. Like you don't get any kind of notification or anything. It's just your warning that on the 15th, a report is going to the leadership team, and they may ask you a question if you're still in assigned status. So this grid will show you the department, the pay period date that this plan is associated with, what's the current status, assigned, reviewed. If it's approved, it won't be in this list anymore. It will drop off. The person it's assigned to, the person that is the approver. So what if I wanted to look at this one, therapy administration, and I want to know why it had an action plan? Well, we can go into the action plan, or we can look first to see what it was. So if you click on the More link, it says the failed criteria set was overtime. Overtime percent of paid exceeded the 2% target. In this case, it was 5.8%. We could go down here. Let's see if we can find another one. That's overtime. This one is productivity. So productivity had 3 components to it. Productivity FTE variance, productivity index current period, productivity index last 4 periods. So the actual result here was below the lower threshold. The target for productivity is always 100%. That's really the goal. But we've given you a threshold range in FHS for 98 to 140, for Roseburg 95 to 110. That's what your leadership team decided upon. So below the lower, and then the FTE variance, if you recall from the criteria, it was half an FTE or more. So in this case, it's about one FTE. So it is above the half an FTE increment. So all 3 of those things were true. Therefore, this department had an action plan assigned for productivity. So now we're ready, let's say, to complete an action plan. So we'll go click on the department number, and that will open up the form. So the action plan form is going to be a series of boxes to fill out. But on the first half of the form, it's going to give you the department number, when it's due, when it expires. It's as of March 10th. Here's the owner. Here's the approver. once you're ready to finish it, you'll use some of these options up here, and we'll go through those in a minute. The opportunity section is kind of showing you what I clicked on when I clicked the More link before. It's telling you what were the criteria sets that failed. In this case, it was productivity. And then these are the 3 metrics associated to that criteria set. And the results, so we can see exactly why. And then the opportunity column, which wasn't in the last screen, this is just showing you on an hours basis the difference between the actual versus target. So when we're ready to complete this plan, first you have to document why did you have the action plan. So we had a productivity variance here, and maybe we didn't excuse me, staff to volume. Obviously you'd write something more elaborate than that. You have to put in a target date. Target date has to be before the expiration date. So it's not necessarily when are you going to complete it, it's more when are you really going to start the plan, because maybe it's going to stretch out the rest of the year. The target completion date, the impact, and these next 2 drop-downs I don't think are very critical, but they are required fields. All these fields are required except for comments. So you do have to fill all of these out, but the most important ones are cause and task. These things will show up on your report, but I think your leadership team is really just going to be focused on cause and task. So for impact, the idea here was, as you're building your plan, what's going to be the impact of your plan in a numeric quantification? And so sometimes that's hard to do just in one single number. At a minimum, you have to put in a 0. You've got to put some value there. I would recommend, as you're writing your plan, to quantify it within the body of the plan itself. If we're addressing, let's say our plan is addressing regular hours, then you'll select, you have to select some type of hours from the list, and you have to select whether it's hours or dollars. Again, I would like to get away from these being required fields because I don't think they provide a whole lot of value, but you do have to select them. And then you'll write your task. And I'm just going to put the word test here in the essence of time. Let's say I remove the impact. Now see what happens when I click save. It says impact cannot be blank. So now I need to go back in and put that in there. Now I can save that task. Once it's saved, you can edit or delete it. I can go in and create a new task. I can create multiple tasks. So maybe your variances will be for multiple criteria sets. You could do a separate task for each one if you wanted to. You don't have to, but you could. Also, only the owner can submit this plan. Actually, the owner and approver can. But anyone else that has view access can come in here and create tasks, but they would not be able to submit the plan. So once you have at least one task saved, you can then submit it. So as the owner, you will only see the submit button. As an approver, you will see these 3 buttons, and these other 3 are for system administrators. If you ever needed to, if you're going to be out on extended leave or something, and you needed to reassign ownership of this plan, reach out to PSG or reach out to your system administrator, and they can reassign it temporarily. If it's more of a long-term reassignment, then we'd actually just go ahead and change the owner. So once you would click submit, and I won't because this is an active action plan, but what would happen is this screen would refresh within a couple seconds, and this status would change to review. And I, being the approver, would receive the email telling me that the owner has completed the plan and now it's time to review. So let me delete that. And then you could close this window. And when you came back to here, this status actually, it wouldn't have changed right away because notice it had opened in a new window. So this window hasn't refreshed at this point. So you would click home or you would click refresh, and that will refresh the page, and then this would change to review status. So once, and it was this one I was working on. So once Jerry, the approver, comes in and approves this, then this one would fall off the list because it's fully approved. But we could go back to the performance summary at that point, and in the performance summary, approved ones will still show up here. You could click on the action plan status to run that department action plan report. So back to the action plans. The other things you can do here, just as a reminder, you can click on column headers to sort. And because there can be a lot of stuff in here for some of you, if you have view access to a lot of things, maybe you're not the approver of everything, you can filter. And so maybe you just want to filter it down to only the ones that apply to you. So for Steve in Houston, I filtered it down to just the 2 departments that I'm actually the approver for. So these are the ones I can be concerned with at this moment. So that is pretty much it for within the application as it stands today. So just to wrap up, going back to the presentation, when you leave here, the first thing first is really logging in. But just keep in mind where the materials are. And we've got this listed on your cheat sheet as well. But you can get the cheat sheet out on these locations as well as these other materials. Make sure you can log in Operations Advisor. You've got access to the right departments. If you're missing any or you need some removed, you need to let us know. Start looking at the reports. For Roseburg, we have reports out there through March 17th. For Tacoma, there's reports out there through March 10th. So start looking at those, compare them to Visionware. Do your audit as soon as you can. Ask your questions. Check the data. If you think something's not right, reach out to us. We want to get that in place before the action plans. Well, I mean, they're already kind of formally required for FHS. For Roseburg, those are going into effect with the pay period ending March 31st. For FHS, for March 10th, you want to go ahead and complete your action plan in Visionware VIP, but also complete it in OA. So you can just copy and paste the text from VIP over to OA. And then after March 10th, we will only be using OA for the action plans. Here's the email address. Leah she's got a lot of facilities she's supporting, so she might be overwhelmed initially these first couple weeks. So the best thing to do is drop an email to our team email. That Leah will see that, I will see that, and a number of other people will see that. So we can all kind of jump on that and tackle questions as they come in. So that's the best way for you to get an immediate response. For Roseburg, Kathy kind of prefers that you go to her initially. But if you're having any trouble reaching her because she is heavy into budget season, you could also copy the PSG, and we can try to help support her as well. So with that, that kind of concludes the session. If you have any questions at all, please reach out to this email, and we'll be happy to help you out. Thanks again. Hope you have a good day.